Hi, I'm Sam Brown. I'm Director of Orthopedic Technology at Southern Crescent Technical College, and today we're going to go through the basic steps of a shoulder exam. Through this shoulder exam, we should be able to pick up on common pathologies such as rotator cuff tears, rotator cuff tendonitis, subacromial impingement, and we will also go through the steps of evaluating someone for anterior dislocations. Okay, we're going to start off with forward flexion. We have the patient do both arms at the same time. What we're looking for is a discrepancy in the range of motion. We want nice symmetrical range of motion for both arms. Back down, go back up one more time. So we're going to look for a range of motion of approximately 160 to 180 degrees of flexion. That's going to depend on the patient. Come back down. Now we're going to check her internal rotation. So the patient comes up to the level of their spine, and you just note what level of the spine it is. Usually the inferior border of her scapula is around T7 or T8. While we're here in the back part, we're going to have her slide down to her waistline, and we're going to perform the lift-off exam. First, she does it unassisted with no resistance, so she lifts off, come back down. Next, I'm going to apply a little bit of pressure to see if we can do a manual muscle test associated with that. In that, we are testing the subscap tendon of the rotator cuff. Next, we're going to do internal and external rotation of the shoulder at 90 degrees of elbow. So I'm going to do internal first. She's going to press in against me. That's testing the subscap again. And then we're going to do external rotation. That is testing the infraspinatus and the teres minor. Next, we're going to bring her up into shoulder abduction. And we're going to have her hold up. And I'm going to just slightly push down. Here we're testing more of the deltoid and a little bit of the supraspinatus. Next, we're going to go to empty can test. The shoulder's at 45 degrees. We're at 90 degrees of flexion. And I'm just going to push down as she pushes up. That's going to test the supraspinatus muscle. While we have her up in this position, we're going to flip her hands over like this. Again, shoulder is at 90 degrees. Elbow is fully extended. And we're going to do a speeds test. The speeds test is for bicep tendonitis. We're going to push down. If she was positive for bicep tendonitis, what we could then do is follow up with the Jurgensen's test. And with this, we're going to palpate the bicep tendon, and we're going to externally and internally rotate her arm, and she should have pain on the bicep tendon in the bicipital groove. Next, we're going to move on to our impingement test. The first one will be the near test, where we bring the patient up. I'm supporting the back posterior aspect of her shoulder, and I'm going to take her up into full flexion, forward flexion. I'm going to just give her a little bounce, and what we're looking for is pain in the patient's facial expressions. Next, we're going to take her into the Hawkins test. Shoulder is at 90 degrees, the elbow is at 90 degrees. I'm supporting the undersurface of her elbow. I'm going to come over the top, and what she's going to do is press up, and what that will do will elicit pain in the subacromial region, and that is usually indicative of shoulder impingement. So through this basic process, we've evaluated all four of the rotator cuff muscles, and we've also evaluated the patient for subacromial impingement. So if the patient comes in and they have a history of a dislocated shoulder, an anterior dislocation, we would proceed with our evaluation of the shoulder to be more specific for those pathologies. So specifically what we will do is do the apprehension and relocation test for the shoulder, anterior shoulder instability. So I bring the patient over to the edge of the exam table, and then what I'm going to do, I'm going to come up, I'm going to bring her abduct her shoulder, and I'm going to start to take her into external rotation. I'm going to support her elbow, and I'm going to bring her into external rotation of the shoulder. And what I'm looking for is apprehension. That's why it's called the apprehension test. The patient will, likely this is the position they will dislocate in, and so as you take them up here, they will get apprehensive. You'll see them start looking at you, and they'll become very uncomfortable with you making this maneuver. So if they are positive for apprehension, what we want to do is take them back up, and I'll support her elbow with my knee, and I'm going to come across, and I'm going to put pressure on the anterior shoulder, and then I'm going to slowly take her back again, and that usually relieves the symptoms of their apprehension. That would be for an anterior shoulder dislocation. Let's go ahead and sit up. If the patient was to fall into the multi-directional instability category, then we'd want to proceed further in doing a sulcus sign or a sulcus test. And with that, we're just gonna come along and we're gonna pull on the humerus, and obviously she's negative, but what we would be looking for is a divot between the acromion process and where the humeral head would be. Very easy to see. But again, those are gonna be with people with multi-directional instabilities.